I have been on the board of directors since the program was founded, and it's a wonderful youth prevention program that was doing a great job before COVID, and it's now being restarted and redirected by Nicole, who is just a terrific leader. And I'm so happy in her role and very grateful to her for picking this up. But Jeremy has been carrying the torch for Mentor for the last year or so during the time of the COVID epidemic, and has done just a fabulous job. So I'm very honored to be working with them. And I want you all to know that Mentor USA is a well-established program all around the world as Mentor programs, and they are all based in a Swedish experience. And the patron of all the mentors, including USA, is the Queen of Sweden. And I'm happy to say I've met her many times, both in Sweden and the United States, and also when I presented at the Vatican with Pope Francis, where the Queen of Sweden was co-sponsoring the meeting with the Pope. So I have a long history with this. The other thing I want you to know, and Nicole mentioned this, I am a practicing psychiatrist, a medical doctor, an MD, and I have been seeing my own patients for more than 50 years, many of them with drug and alcohol problems. So I have been involved in this issue for a long time, and it's a difficult challenge, and one that's going to be with us forever to come. The modern drug epidemic began in about 1960, and it began with young people. And the focus has been on young people all along in many ways. But what we're going to talk about tonight in our this presentation is a different way of thinking about youth and drugs. And it's based on science. It's not somebody went into a phone booth and came out with some ideas. It's based on research. You're going to see some good examples of that research this evening. I'll go over those in the slides in our discussions. But the striking thing is how the decision to use drugs is typically made between the ages of 10 and 21, mostly 13 to 16. It's striking to many people how young that really is. And of course, the effects of that decision, whether to use or not to use, can have profound effects on people's lives well into adulthood and even into old age. It's a very fateful decision, and it's a very important one. For a long time, people just thought it was a rite of passage that everybody tried lots of drugs when they're young. And it turns out that first of all, that's never been true, but it's now we find that youth are leading the way in answering the question of how to approach the problem of youth drug use. So that's by my background. Let's see the next slide. All right. Okay, one of the most striking things about addiction and substance use disorders, that's the new name for addiction, is that 90% of the drug use begins before the age of 18. Now think about that. If a person gets to be 18 or 21, the likelihood of their deciding to start using drugs goes way down. And the younger the person is and the heavier the use, the more likely they are to develop problems with the drugs later in the life. And all substance use increases the risk of many health outcomes, not just overdose deaths, but car accidents and failure economically and educationally and everything else. Anything bad is most likely related to behavior is likely to be positively correlated with drug use. But the focus on this slide is to see that drug use disorder, addiction, is a pediatric onset disease. It is certainly before the age of 21 and mostly before the age of 18. Next slide. And this is a slide about how the brain develops in terms of the time. And the fully developed brain is the purple that you see over on the right. And you'll notice that at the age of 20, it's still not fully developed. But you see how in the ages from 5 to 20, there's a movement in those colors. And that has to do with the maturing of the brain. The brain doesn't fully mature until about 25, so even later than this, before it all turns to purple. And that means that the brain in the earlier ages is particularly vulnerable to addiction. So that starting drug use at 25 has entirely different consequences than starting it at 15. And the younger the use starts, the more malignant the consequences to it. This fact that the youth brain is uniquely vulnerable to drug addiction, you can see that again by that slide we just had about how 90% is before the age of 18. Next slide. Now, the sort of old way to think about drugs and youth is that trying drugs, experimenting with drugs, is a rite of passage for adolescents. That teenagers are inquisitive, are curious, they try new things, and one of the new things that they do is to try drugs to see what they think about that. And so the old way normalized teenage experimental drug use. Everyone uses it as a teenager. And many adults still think this way, that they see the experimenting with drugs as being a rite of passage for people as they grow into adulthood. But over the last 4 decades, 40 years, American youth have been rewriting that script and showing that it is not only wrong, but dangerously wrong. And we're going to talk about how that is and what that rewriting of the script looks like. Next slide. Now this is a little complicated, and it's, you take a couple of deep breaths. So I want you to reflect on this with me. So don't rush through it and don't jump to conclusions that you can't figure it out, because it's actually pretty simple once you don't. Just look at the orange line. That's alcohol use. And what those numbers are for that 40 years, 45 years, is what percentage of high school seniors in the United States used any alcohol, or a lot of alcohol, but at least some alcohol in the last 30 days. And you'll notice around 1980 that the number is 42%. In other words, about 3/4 of American high school students used alcohol, some alcohol, in the last 30 days. Now look at where that number is now. Now it's at 30%. Think about that change, 72 to 30. And look at how that drop has come there. And it was particularly striking after the passage of the law to change the drinking age from 18 to 21 that occurred in the late 1980s. But you'll see that the steady drop that has gone on, that is a huge drop, 72 to 30 over the course of that 40 years in alcohol use. Now look at the yellow line. That's cigarette smoking. And you see that also had the same peak. They all had this right around very similar times for the peaks of all of them. It had there, and then it came down kind of slowly. And then all of a sudden, about 1998, it took a plummet. So that yellow line suddenly falls off. So it goes from a peak of about 40% back before 1980 to down below 10% now. That's a very big drop. Now, the reason for that precipitous drop was the truth campaign funded by the cigarette money that has done a terrific job in educating young people. So kids smoking tobacco now in high school is quite unusual, where it used to be very, very common. Marijuana, the green line, is a little different in its shape. It also is down considerably below. The peak was about 40, and the current number is a little bit more than 20. But you'll notice it went down very dramatically for a while, and then now it's come back up a little bit. Not as high as it was, but it's come back up. Now, my point about this is, if you look at, those are the 3 main drugs that people use, by far the biggest ones. We're going to talk about other drugs too, but those are the big ones. You'll see that the downward trend you see, and you see how what we've done about things has had an effect on the curve. Where with alcohol, we raised the drinking age from 18 to 21. With cigarettes, we had the truth campaign. And with marijuana, we had the legalization movement that started about 1995, and that changed that trajectory. But you'll notice also that the marijuana number has passed the cigarette number around 2009, and it's on a track to pass alcohol within the next few years. I think that's pretty striking. But anyway, that's the picture of youth drug use. Next slide. Okay, this is another one that's going to take you a minute to look at. So just look at the blue line. We'll talk about the purple line separately in a minute. This is, again, we're back to high school seniors, and we're looking at the question of, the blue line looks at what percentage of high school seniors had no use of any alcohol, any cigarettes, any marijuana, or any other drugs in the past year. So that's the in their lifetime, not in the past year, but in their lifetime. So the blue line is the percentage who have not used any alcohol, any cigarettes, any marijuana, or any other drug in their lifetime. You see it's about 3%, and it's back there around 1983 also. But look what it is now, 36.5%. That's an enormous change in youth behavior. And it shows what a large percentage. In 1983, a young person who didn't use drugs at all, ever in his life, or her lifetime, was very rare. But now it's quite common. It's more than a third, and never in their lifetime. And now look at the purple line. That's the people, what they've used in the past month, non-use in the past month. And you'll see the low point is about 16%, again, back about that same time in 1983. But now it's 64% essentially of American youth, 16% to 63.9%. That is a huge trend. The main point of this entire talk is in this slide. And what it shows is American youth have made a profound change about that narrative that using drugs is a normal, common rite of passage. If you go back to 1983, you'd say that was right. It was right to say that. But if you look out there to 2021, it's wrong. It is completely wrong, because what you've got is an enormous percentage. In the last 30 days, it's 64%. In the last lifetime, it's 37%. An enormous percent of young people have made a decision not to use any drugs. I really want that to sink into you. That is, and it's been not widely recognized, but this is from national data. That is the way the country keeps track of youth drug use. We put this slide together, but it's from data that is gathered by the US government. So it's absolutely solid stuff. And what it shows is exactly the point that this whole presentation is about. And that is youth themselves in this country are leading the way toward a drug-free youth. That's a very big deal. Next slide. Okay, what are we saying? We're not saying that all the drugs become illegal or that people should be locked up. We're talking about a health standard. And look at the seatbelts. We have a health standard that everybody in America knows. If you are in an automobile, in a vehicle, you should wear seatbelts. That's a health standard. It also, in this case, is a law. But the key, what we're talking about, I'm talking about, is it's a health standard. The healthy choice is to wear seatbelts. Not wearing seatbelts is not healthy. It's not good for you. And the same thing is true about bicycle helmets. Not wearing helmets on a bike, it used to be that was very common. Nobody had helmets for bikes. But now it's a health standard. And the same thing about eating healthy foods and exercise. Those are health standards. And what this one choice initiative that Mentor USA is now promoting is to add another dot to this, and that is youth drug use. Be right up there with those other ones as a health standard. That's what this is all about. Okay, next slide. And here I'm putting the one choice idea into words, because people talk about being drug-free, but they often don't make clear what exactly that is. And one choice is exact, it's clear, it's unmistakable. So here it is, word for word, and I'm going to read it slowly because it's very important that you understand. You've taken the time to be here, for which I'm very appreciative, but I want to make sure you understand this. The healthy choice is this: no use of any alcohol, nicotine, including vaping, marijuana, or other drugs by youth under the age of 21 for reasons of health. Okay, that's the health standard. Why did we pick 21? Because that's the legal age to buy it. All those things, alcohol, nicotine, vaping, are illegal under 21. And also because of biology, because the brain is so vulnerable under 21. Lots and lots of young people are concerned about their brains. They're concerned about their future, and they don't want to do things that are put at risk. Drug use puts it at risk, and no use prevents that from being a problem. Next slide. Okay, now I'm going to talk about another idea. Turn a page in your mind and think with me about something entirely different. Now we're not talking about the trends in drug use. We're talking about how all drug use is related for teens. That's really an important concept. This comes from the household survey, as it's called, the National Survey of Drug Use and Health. And again, it's a national sample collected by the federal government. And we're going to look at the question of how does the use of one drug affect the use of another drug? In other words, to what extent, I like this picture you have here, to what extent is one hand related to the other? And we're going to see some data about that I think you're going to find both interesting and surprising. Next slide. Okay, now you take another deep breath. You did it last time, and I want you to do it again. You're going to think this is very complicated. It really isn't very complicated, but you have to sort of open your mind to what it is I'm saying. So here you go. Over on the left are 12 to 17-year-olds who have not used any marijuana in the past month. Okay, that's the left-hand side. On the right-hand side are 12 to 17-year-olds in the United States who have used any marijuana. They may have just used it once. They may use it every day. They're in this side, on the right side, if they used any marijuana, either one or every day. They're all in the right side if they used any marijuana. And so the question is, does it matter that they use marijuana in terms of their alcohol use? Now that's the orange one. So you go back over to the left and you'll see that 8% of the 12 to 17-year-olds who had not used marijuana in the past month had used alcohol. Now, if they'd used any alcohol at all, it's 44.6%. Look at how different that is. And the only difference between the two sides is that they use any marijuana. And then you look at binge drinking, which means drinking 4 or 5 or more drinks in one setting. It's 3.5% versus 27.5%. Look at that change, nearly 10 times as much. All the difference is on the two sides with binge drinking is, did they have any marijuana use? And you see the same thing for heavy alcohol use, means multiple binge drinking episodes. And there it's 0.4% for 6%, even bigger change. What is that? I don't know, 30%, 20 or 30 times what it was before. And the same thing is true for cigarettes, 2.7% if they had not used marijuana, and 23.6% if they have, and other illicit drugs, 2.2 to 21.7. So I hope I've convinced you of a very simple observation, and that is, you use any marijuana, you increase enormously the risk of using other drugs. This is from American students, American youth, 12 to 17-year-old. Okay, next slide. Now we're going to do, I talked about, on the left-hand side was marijuana. Now I'm going to put alcohol over there. So on the left-hand side is 12 to 17-year-olds who have not used any alcohol in the past month. The percentage of them who used marijuana was 3.5%. Now come over to the right side, and this is, we got things separate here. We've got some alcohol use, binge drinking, and heavy alcohol use. So now we're looking at how much alcohol they used. And so you see that 3.5%, 20% of them, from 3.5 to 20%, was the difference in any alcohol use. Binge drinking was 2.2% to 16.7, and cigarette use I put in there also, that's the yellow, and you'll see it's 2.5% to 33%. Now, what I'm saying to you and asking you to think about is how intensely related any use of any drug, and we've used here alcohol and marijuana, we can do it with other drugs as well, any of it is highly related with all the other drugs. That it's not just one decision. It's one decision to use has profound effects of any drug, has profound effects on the use of all other drugs. And here you see the data very clearly presented on that. Next slide. Okay, we look at this with cigarettes, and you see exactly the same relationship. So alcohol use, no cigarette use, 9.5% had any alcohol use, and 39.7% if they'd used any cigarettes. And you see the same thing for binge alcohol use, heavy alcohol use, marijuana use, and other illicit drug use. Very dramatic differences you see there in that likelihood. Next slide. Okay, now I wanted to again take a deep breath again with me and talk about how does drug use start? How do kids get started using drugs? And there's a lot of confusion about this, but it's very simple what it is. It acts like a contagious disease, like COVID. It spreads from one person to another. It spreads from a person who is using, a young person who's using, in the same grade usually, or maybe a little older or a little younger, but mostly in the same grade or close. Somebody that the person knows who has not used says to that person, why don't you try X? Why don't you try alcohol? Why don't you try cigarettes? Why don't you try marijuana or any other drug? And the people who do this spreading do not do it maliciously. They're having fun with their drug use. They haven't mostly had problems with it. And they think it's wonderful and they want to share the fun with their friends. So it's not malicious. It's just, see, maybe this would help you with your sleep or your headaches or anything else like that. And the fact is that when people start using drugs, they can die of an overdose of fentanyl from one pill. That can happen. But most of the time, the consequences are not serious, and there aren't adverse consequences from the use. And the young person is started in. Now, as you see here, the fentanyl is changing that conversation because one pill can kill in that situation. But most of the time, that's not what happens. And this is how the use spreads. And I think in terms of youth who have not used, it's important to immunize them about this and expect that there will be times when friends who are using will try to recruit them into use, and the negative consequences are often felt later after this period of time. That you see those negative consequences. It reels them in. Now, some people will try a drug and not like it and not use it anymore. That's true, but there's a risk that is unpredictable, and nobody knows what that outcome is going to be. Next slide. So is non-use communicable. And one of my major points in this presentation is to amplify the voice of the growing number of young people who are not using any alcohol, any cigarettes, any nicotine, any marijuana or other drugs, and to have them speak up in their peer groups about why they make the one choice, and to let them know how it's working out. People who make this choice, we call them one choice youth, often stay silent about it. But I'm encouraging them to not be silent, but to speak up about it, how it works for them, why they do it, how they feel about it, all the rest of that. And that is at least as communicable as the drugs. It has not been done as much as I would like to do. And the whole point of what we're doing is to have the message be carried by youth about the success they're having with not using a drug in their social life, in their academic life, in their families, everywhere. Next slide. So who can make one choice? Not only is it people who've never in their lifetimes not used, but anybody can do that. People who have used in the past and are now making the choice not to use are one choice people too. Individuals with substance addiction and drug use problems can make the choice. That's very much true too. So my last slide. I want to thank you all for being with me here tonight on this. And again, I want to promote Mentor USA and thank Jeremy and Nicole for their leadership, and to let you and them know how proud I am to be on the Mentor board and to be here tonight. So I'll turn it back to you, Jeremy.
All right. Yeah, thank you very much for that wonderful presentation. I guess I wanted to start off like the disclaimer first. So we're not saying that if you have used in the past, you can't be a part of this decision, this movement. But it's rather, if you could, would you make that decision to follow the one choice? And it doesn't only encompass, oh, someone might want to use alcohol, nicotine, marijuana, the other drugs that we've mentioned, but we're gonna try to educate the youth so they can make their own decision, and that they have the knowledge, and that they're making smarter choices when they're young, obviously, since their brain is still developing.
Jeremy, could I interrupt for just one second? Could you tell me and the audience, when you have done this in the past as the youth leader of Mentor, what reaction do you get from other kids about that message of yours?
So personally, what I've noticed, well, I've graduated high school 5 years ago now, but people are very respecting of your decision. Of if someone is illegally using a drug, or at the time, the vaping epidemic, that was growing pretty substantially. They would be like, oh, Jeremy doesn't do that. You just try to fit in, and you can, I guess, connect with people in other ways than just drugs. So if that's ever brought up in a conversation, they understand that, peer pressure, I feel it's not as big as a thing as it was in the past. And that's probably due to the effectiveness of all the campaigns that we have now. Red Ribbon was really big. We always did Red Ribbon. That's where everybody signed a pledge, and they would hang them all in the hallways. And then, of course, as you mentioned, we see the ads on televisions, but I guess one thing that I would want to know is how is it different now than when you were growing up? Is the campaigns, what kind of things did the times are obviously very different then. Like what was your experience when you were growing up?
Okay, I was growing up when the kids today, their grandparents were growing up. So we've got to make 2 generations of a leap there to get to that. But nobody I knew used any drug other than cigarettes and alcohol. There was no marijuana. There was no cocaine. Nobody I knew never talked about it. It wasn't in the newspapers or anything else. No kid I knew did that, just those 2 drugs. And there was very little resistance to using them. So lots of kids did. Like we showed that data, about 72% had used within the last month, for example. That was very common. And so it was a very different scene. The world changed in the late 1960s, and that's when the drugs became plentiful, and marijuana was in the lead about that, and that change. But there were a lot of people in college. One of the men that college students, I was a freshman, he was a senior, and I looked up to him very much. and he was driving a car drunk, crashed the car, and his girlfriend was severely injured, had broken her neck. And I visited her in the hospital, talked to her. Her mother was telling me how she was a real hard worker and she was going to get back her movement and everything. But the reality was she was never going to walk or move her hands ever again. And I thought about that. That guy is going to carry all his life the consequences that she was a quadriplegic. And the mother was very brave, and that was all that, but that wasn't going to make any difference. It wasn't going to happen. And I thought, boy, one minute can change the life in a way that made a big impression on me. Let me put it that way, to talk to that mother and that daughter.
And I guess a follow-up question to that would be, obviously drinking and operating a vehicle, that's probably the worst, if not the worst environment that you could have. What would you say to people that, maybe they're in their parents' basement and, they're just experimenting for the first time and they're just curious,
Yeah. Well, I have a thing that I have a daughter who I work with, who's a psychiatrist also. And when we were talking about this, she said she didn't want to try cigarettes because she might like them. And I think that is the right answer, that you might like it. That would be a problem. If you didn't like it, it's not going to be much of a problem. The problem is if you do like it, and then the problems are just starting. They go on, and it takes a while for that to happen. So that's where I am with that issue about just trying it. The other thing is, just trying what? Just trying marijuana, just trying alcohol, just trying nicotine, just trying cocaine, fentanyl. Where do you draw the line? Once you've crossed over that line to be a drug user, there's 1,000 other questions that you have to make. Let's say a kid has never used opiates before and uses marijuana and alcohol and gets into a party and somebody says, here's a pill, why don't you try this and see what happens? And that's an opiate, or fentanyl. They would not know that. They wouldn't have any way to know what that was. Again, they could die of an overdose, but that's not so likely. They might like it. That's where it would be the problem in that, because what the drugs are doing is tricking the brain. They're hijacking the pleasure centers of the brain, and the chemicals are very good at doing that. It's and the first time they do it, nothing happens, and they don't think this is any problem, so use it again and raise the dose and all those things. That's a slippery slope, and that's true for every drug, not for just one. That's true for alcohol. That's true for cigarettes. A lot of people when they're young will have a cigarette once a month. But what's down that road is 20 cigarettes a day.
And obviously, some people have a more intense reaction to a certain substance, or maybe they're born and their brain is wired a certain way, so it's obviously going to be a lot more harmful to one person than another, and you wouldn't know that unless you tried it. So the best decision would be just not try it at all.
See, that's just like wearing seatbelts. Most people will never be saved by wearing a seatbelt. Most people today who are wearing a seatbelt will never have a benefit from the seatbelt. But who's going to be dead is unpredictable. And they're running a risk without the seatbelt that is life and death, like that. And I think that's true with the drugs. Yes, there are people who don't wear a seatbelt and who use drugs and nothing bad happens. There really are people who don't have that happen. That's right. And they're not just a few, there's a lot of them. But that risk is unpredictable and is completely predictable with one decision. That's why it's called one choice. One decision. You don't have to make it 100 times. You don't have to make it in 100 settings with 100 peer groups. You just do it once. And that takes care of it. You don't have to think of how many I'm going to use, what a setting is, and all of that stuff. That's all gone. And you can get on to dealing with a lot more productive things you're going to do. And it's also now young people are much more focused on mental health, and they want to protect their brains. They want to protect their lives. So the idea of taking an unpredictable risk, whether it's not wearing a seatbelt or using drugs, is not appealing to a lot of kids now who wouldn't have thought about it, to kids in those positions 10 or 20 years ago.
And yeah, I think it's very motivating that we're seeing this with substance use. The growing number of young people are choosing, of course, not to use at all. But this can't, only stop here. This could, go, like you've talked about, mental health, any other aspect of health. One thing that a lot of people mention is also financial health, that maybe we should have that in school as well.
Well, one of the things about the drugs, they're all expensive also.
Yep. It is. Yep. And especially when you're young, you don't have money. So it's either you get it from a friend, maybe a family member. There's always a kind of, I guess, dirty way of feeling about it.
Right, right. Well, it's deciding you like it and you like it enough to spend that money. That's a bad outcome, not a good outcome.
I was checking here if we had any questions from any of the participants.
Yeah, I have a question from the chat. Janet says the one choice information is a game changer and we appreciate your leadership developing it and sharing it with the world. What progress do you see in pediatric medicine and offices of public health embracing and sharing the one choice health standard?
We have had extreme success with the National Academy of Pediatrics, which is huge, to get them to say the National Academy of Pediatrics, that's the Association for all pediatricians, has publicly said the healthy choice for youth is no use. That's because of our work with a woman named Sharon Levy at Harvard Medical School. That's a big deal to get pediatricians, because pediatricians before didn't want to alienate the kids who were using drugs. If they're using drugs and they don't have problems, the pediatrician would just ignore it, let it just go on. There's no problem here. Not anymore. The National Pediatric Association, that's one of our really big successes in that. But there's a long way to go. There's lots of people who, adults will say, well, it's just a little beer or a little marijuana. It's not very much. It's interesting. A lot of the people who are talking about kids who are dying of overdoses, they know the kids were using drugs, but they didn't know they were using fentanyl, or they didn't know they were using a lot. And that whole business of sort of forgiving that and say, oh, it's only marijuana, it's only alcohol, or whatever you do. That's a dangerous position for parents to take.
Let's see a question to Jeremy. According to my opinion, what is one of the best ways to communicate one choice to your peers / youth? I'd say peer-to-peer, just word of mouth. Also social media. Everybody's always on their phones now. But it has to be authentic, and I think a lot of what is coming from influencers and celebrities has a lot of value, especially today. So we should be a lot more careful in who we're following, who we're looking up to. Prioritizing other aspects of health rather than just saying, oh, that looks cool, I'd want to try that someday. Maybe he has a lot of money, I should follow him because of that. And on the side, there's a video of him like smoking marijuana. You don't know where someone should take the stand of saying, that's too much, I shouldn't follow them anymore. It reminds me of cancel culture almost. Of where do you draw the line of where you think something is right? I think that's more of an individual approach. What do you think about that, Dr. DuPont?
Well, I think you got a very good point about that. And once you decide you're going to have any, then you've got a problem on your hands. You were talking about where is that line, and it turns out that line is pretty easily moved. You may start out, I'm going to do it once and that's it. I was not going to do it again, or I'm going to do it once a week, or I'll only do it one time, or I'll just have one beer. People get into this are seduced by themselves. I don't think the other person is hostile to them. They're just sharing what's fun for them, and it becomes a very big challenge. It's interesting. You see adults who drink a little bit, like one drink a month, one drink a week. There's a lot of adults like that. There are eventually no students, no kids like that. Kids get to drink to get drunk. It's very interesting to see that difference of patterns about the drug use, and that happens with other drugs too. We lost Jeremy. I went on rattling on too long, I'm afraid.
Yeah, I'm not sure where you went.
Nicole, why don't you wrap it up?
Okay, I will do that. We have one more question, and I think that you and I can both address this. This comes from Francisco. Any interest in partnering with state education or state health agencies? And I think for both of our organizations, One Choice and Mentor, yes, absolutely.
And I echo that completely. I am really proud to be part of Mentor USA, and Nicole is a fabulous leader. So if you guys want to get started, I would start with her, and I'll be in her hip pocket, ready to do what I can to help.
My secret weapon.
Yeah.
All right. Well, thank you all so much for joining. We have been recording, so if you want to come back to this, we'll have it in our next newsletter. We'll also have it posted on our blog, on our website, and probably on some social media channels as well. If you any follow-up questions, you can continue to send them via I think we have the contact emails or contact information in the slides. But yeah, thank you all so much. It's been a pleasure. I want to thank Dr. DuPont, and I would thank, here's Jeremy.
He's in the waiting room.
He was, yes.
The poor guy.
I know.
Well, he did a great job.
Kick him out and then put him in the waiting room. Hang on, let me, there, hi.
I'm sorry about that. I think that my laptop was low on battery and it automatically shut it down.
I hate that. But we were just wrapping it up. I was actually just about to thank you for providing some really, really essential insight into the youth perspective on this topic, and to Dr. DuPont for providing all of the academic research and all of the lovely statistics to support the idea of One Choice. We look forward to the next series, the next Mentor Inspo coming soon, right? In maybe the next month or two. We're also going to be sending out a form for you all to fill out, just kind of getting your feedback on how you think this webinar went, and getting a little bit more information about you. You can also use that as a way to provide any contact information for reaching out and maybe doing some partnerships in the future. All right. Thank you all. Take care.
Thank you. Bye-bye.
Bye-bye.
Thank you.
Everyone.